My name's Gretchen Hurdle. I will be doing a head to toe assessment for Nursing 115 and Professor Robinson. I'm going to go ahead and scan the room really quick so that you can see that there's no assistive devices. Okay, I'm going to start the assessment by assuming that ADIT has already been done. I checked the patient. I looked at her records before entering the room. I introduced myself. Hello, my name is Gretchen. I'll be your student nurse today. I'm here to take a head to toe assessment for you, and it'll take about 30 minutes. Can I go ahead and see your wristband? Can you tell me your name and date of birth?
Samantha Strati, 2/21/96.
Wonderful. I'm going to observe the room and see if there's any open wires, open tubing anywhere. I'm going to look at the patient and see if there's any signs of difficulty breathing, any pain, and I'm going to look at the color of her skin. I would then obtain a set of vitals. I have already obtained a set of vitals for this patient, so I will not be doing that right now. And then I will ask her if she knows where she is. Do you know where you're at right now?
Yes, my basement.
Awesome. Do you know what time of day it is?
Evening.
Do you know what you ate for breakfast?
Yogurt.
I would then document that the patient is alert and oriented ×3. I would go ahead and start my assessment, starting with her ears. I would take my pen light, and I'm going to start with the outside of the ear, checking and seeing if there's any edema or swelling. Ask if there's any tenderness. I'm going to use my pen light to look inside the ear canal while pulling back the pinna. I'm then going to do a whisper test. I'm going to go ahead and cover this ear with one hand. I'm going to whisper a number on the side. I want you to repeat it to me.
12.
Very good. Do it this side as well.
14.
Very good. I'm then going to assess the patient's eyelids, looking for color and any edema, and just make sure they're both pretty equal in size. I am then going to check accommodation. I'm going to shine a light in one eye, look for pupil contraction, and then look for pupil contraction in the other eye. Very good. I'm going to do it on the other side. I would also dim the light while I was doing that so that I can definitely see the pupil contraction for people with darker eyes. I'm going to do a convergence test. I'm going to have you follow my pen light. Very good. And then cardinal directions. Go ahead, don't move your head, just follow with your eyes. Making sure to go up, down, side to side, and diagonal. And then I'm going to have you look at my pen light and then look at the wall behind me. Making sure to keep it 12 inches away from the patient's face. Very good. I am then going to begin the assessment of the head, neck, and face. I'm going to go ahead and have you smile and frown. Puff out your cheeks and wrinkle your forehead. Very good. Then tongue side to side. Very good. Go ahead and say ah. Ah. At this point, I would put on gloves and use take out the dentures if need be. I am going to go ahead and give the patient a tissue while I put on gloves. I would have performed hand hygiene before touching the patient. I would ask the patient to blow their nose. Very good. And then I would take this and check and assess and dispose of the gloves in a proper waste can. I would then perform hand hygiene again because I just touched a tissue. Go ahead and plug one nostril and take a deep breath in. And go ahead and do the same with the other side. I will use my pen light. Ask the patient to tilt their head back 30 degrees. Check for color, swelling, any edema within the nose. Make sure the septum is intact. I would then go ahead and check the scalp and palpate the scalp, looking for any infestations, any lesions, and just making sure that it's in good condition. And then I'm going to go ahead and palpate the frontal sinuses, asking if there's any issues, any pain, any tenderness. And I'm going to do the same with the maxillary. Everything feel good?
Mm-hmm.
Okay, I'm going to have you clench your jaw and open up your mouth. Very good. And I'm going to have you push against my cheek, or against my hand with your cheek. Good. Do the other side. Okay. And then I'm going to have you put your chin all the way down to your chest and your head all the way back. Ear to each shoulder. Very good. Turn left to right. And then I'm going to go ahead and have you push up. Very good. I'm going to palpate the carotid pulse on both sides, making sure that the pulse is bounding and I can feel it. I'll go ahead and have you lift up your neck just a little bit. Good. I'm going to check for vein distension. I'm also going to make sure that her trachea and esophagus are aligned. I'm going to auscultate the carotid artery, listening for a bruit. Again, documenting the pace, rhythm. Very good. Okay. I am then going to go ahead and move down to the thorax, performing hand hygiene as I go from section of the body to section of the body. Okay, I am first going to inspect the patient's front and back, only exposing what I need to during my inspection. I'm checking the skin for texture, turgor, color, and any abnormalities and lesions. I'm going to do the front, same with her front. I'm going to put my hands here. I'm going to have you say 99.
99.
Feeling the vibrations. And do the same thing on the back.
99.
Very good. I am then going to auscultate breath sounds, going from right to left, left to right, all the way to the apex, starting under. Go ahead and breathe deeply and normally, in through your nose and out through your mouth. Making me go through one respiratory cycle for each movement. Very good. Noting the depth and rhythm of respiratory sounds. Also, different pitches. I'm going to go ahead and do the same thing on the back side. Making sure that the patient is breathing in deeply and normal. Go ahead and move your hair. Okay. Go ahead and breathe in and out. I would ask the patient to sit up, and I'm going to place my hands with my thumbs inward on T9 and T10, asking the patient to take a deep breath in, noting the separation of my thumbs and making sure that it's symmetrical. I would then go ahead and start listening to the heart. I would go from aortic to pulmonic, Erb's point, tricuspid, and then mitral as I go through, making sure that when I start at my applicable pulse, I will be at the 5th intercostal space. Again, making sure to only expose what I need to when doing my examination. And pulmonary. And Erb's point. Very good. Tricuspid and mitral. I will now take an applicable pulse, which I will be doing for 60 seconds. I would then note that the pulse was normal, had a bounding rhythm, and was just very strong. I would then ask the patient to lay supine. So go ahead and lay back. You can just use the recliner if you want. You're good. Again, during this entire assessment, I will be looking at hair, the integument system, skin, making sure that I am assessing the texture, turgor, temperature, and color. I will begin to auscultate the GI system, starting with the upper right quadrant, moving my way left and then back down in a systematic fashion, making sure to listen for gurgles and clicks, and if I don't hear anything, to make sure I wait a minute until I do hear something. I will use the diaphragm of the stethoscope and the bell to hear deeper, lower pitches. I will then palpate, again going in a systematic fashion, starting off gently with just the tips of my fingers, moving about 1 centimeter at a time, asking the patient if they have any pain or tenderness where I'm pushing. Do you have any pain or tenderness?
No.
Okay. Noting distension, any muscle tightness, or swelling, edema. I will then go back through, doing a wave motion with my fingers, pushing in a little bit more. Again, noting any pain or tenderness the patient may have. I'm also assessing the face for signs of any nonverbal pain. Very good. I will go ahead and have you sit up. And I'm going to start with the upper extremities. Go ahead and flex your hands for me. Very good. And push against my hand. Push against my hand. I'm going to assess the patient. Again, exposing only what I need to, assessing color, texture, temperature. I'm going to palpate the brachial pulse. And the radial pulse. Check the patient for capillary refill. Very good. I'm going to go ahead and have you squeeze my fingers. Very good. Squeeze my fingers. And then I'm going to go ahead and start with the lower extremities. I would ask the patient to push in against my hand. In and against my hand. Go ahead and go outwards, checking adduction and abduction. And then push up against my hand. Against my hand. Okay, and then push up with your toes. Very good. Up your toes. And then go ahead and push down. And push down. I would then palpate, checking for any edema, color, texture, any lesions on the skin. I can use my pen light. Good job, Gina. Use my pen light and I'm gonna go ahead and see your foot. Checking for any retraction. Making sure that the toes are crunching and not going away. I'll have the patient stand up if they can, and I would assess their gait and balance. Good. Okay, go ahead and sit down. I would then thank the patient. Thank you, Mrs. Strati, for letting me do my physical assessment on you. Is there anything else I can get for you?
No.
I would make sure that the water and the call light was next to their bed. If their bed was in the lowest position and the rails were up, I would go ahead and leave, assess the area for any disturbances, and I would document everything in the EHR.